Welcome back to the Dr. Paul Health and Wellness System podcast, where we answer important questions related to pregnancy, childbirth, postpartum recovery, and women's health in a way that is simple, practical, and easy to understand. In our last episode, we talked about some of the common lifestyle mistakes women make during pregnancy and how those everyday habits can affect both mother and baby. Today, we're taking the conversation a step further. We're looking at what can happen after childbirth, from joint and back pain to hormonal, thyroid, heart, bone, and other changes that some women experience after pregnancy. So if you've ever wondered, why does my body still feel different after having a baby? This episode is for you. Let's get into it. Yes, joint pain after childbirth is something many women experience. During pregnancy, your body changes the way it carries weight. Your posture changes, your muscles work differently, and the joints around your pelvis and lower back are placed under additional strain. Then after delivery, you suddenly start lifting your baby, bending over a cot, breastfeeding in different positions, and sometimes sleeping very little. All of these can contribute to pain in the knees, hips, wrists, shoulders, and back. Hormonal and immune changes after delivery can also make existing inflammatory joint conditions become more noticeable or flare. If the pain is mild, good posture, gentle movement, adequate rest, and gradually rebuilding your strength can help. But if a joint becomes very swollen, red, hot, extremely painful, or the pain continues for months, please speak with your doctor. We should not automatically blame every joint problem on childbirth. This one is very common. Think about what happens during pregnancy. As your belly grows, your center of gravity moves forward. Your abdominal muscles stretch, your posture changes, and the muscles supporting your spine have to work differently. After childbirth, those muscles do not immediately return to their previous strength. Then you add carrying a baby, bending repeatedly, feeding the baby, changing diapers, and sometimes sitting in uncomfortable positions for long periods. So the back can continue to hurt even though the pregnancy is over. Work gradually on your core and pelvic floor strength when your healthcare professional says it is safe. Pay attention to lifting and feeding positions. Persistent back pain deserves assessment, and severe back pain after pregnancy should not simply be dismissed as normal, particularly if there is leg weakness, numbness, loss of bladder or bowel control, fever, or severe pain following even a minor injury. Pregnancy changes the immune system significantly. After the baby is born, the immune system shifts again. In some women, that change can trigger inflammation of the thyroid gland. We call this postpartum thyroiditis. The thyroid may initially become overactive, causing symptoms such as a racing heart, anxiety, sweating, or unexplained weight loss. Later, it can become underactive, leading to tiredness, feeling cold, constipation, weight gain, dry skin, or low mood. For some women, the thyroid eventually returns to normal. For others, hypothyroidism can remain and require treatment. If you feel unusually exhausted, shaky, extremely anxious, unusually cold, have significant unexplained weight changes, or notice persistent heart palpitations after delivery, talk to your doctor. A simple thyroid blood test can help identify the problem. Let me reassure mothers about this one. In many cases, postpartum hair shedding is temporary. During pregnancy, high hormone levels keep more hairs in their growing phase, so your hair may actually look fuller. After childbirth, hormone levels fall rapidly. A large number of hairs can then enter their resting and shedding phase around the same time. So a few months later, you may suddenly notice much more hair coming out while washing or brushing. It can look frightening, but in most women, the hair growth cycle gradually returns toward normal. Eat a balanced diet and avoid unnecessarily aggressive hair treatments. But if hair loss is extreme, continues for a long time, produces bald patches, or comes with severe fatigue or other symptoms, ask your doctor to check for conditions such as thyroid problems, iron deficiency, or other causes. During pregnancy, your heart does much more work than usual because it has to pump blood for both you and your developing baby. Most women tolerate those changes very well. But pregnancy can sometimes reveal a heart condition that was previously silent. And in rare cases, a woman can develop peripartum cardiomyopathy, a form of heart failure that usually appears late in pregnancy or during the months after childbirth. Pregnancy complications such as high blood pressure and preeclampsia are also important signals when we think about a woman's future cardiovascular health. If after delivery you experience unusual shortness of breath, difficulty breathing when lying down, chest pain, fainting, persistent rapid heartbeat, or sudden significant swelling, please seek medical care urgently. Do not assume every symptom is simply exhaustion from caring for a newborn. Yes, but let me put this into perspective. Stroke in pregnancy is uncommon. Pregnancy naturally makes the blood more likely to clot, which helps protect a woman from excessive bleeding during childbirth. Blood pressure disorders such as preeclampsia can also increase stroke risk. The risk is particularly important during pregnancy and the early postpartum period. Current American Heart Association guidance describes maternal stroke as rare but potentially life-threatening. Every pregnant and postpartum woman should know the warning signs: sudden weakness or numbness on one side, facial drooping, difficulty speaking, severe sudden headache, confusion, trouble seeing, or loss of balance. Those are emergencies. Seek help immediately. Because pregnancy doesn't simply involve your uterus, your abdominal wall stretches, your pelvic floor carries considerable pressure, your breasts change, your body weight and fat distribution may change, your posture changes, hormones change. Some changes recover within weeks, while others may take months, and some women can experience longer-lasting differences. And remember, life changes too. Sleep, exercise, eating patterns, stress, work, breastfeeding, and caring for children can all influence how your body feels. Please don't assume that feeling unwell years later is simply because you had children. Persistent fatigue, pain, abnormal bleeding, urinary problems, weakness, unexplained weight changes, or other symptoms deserve proper evaluation. This question needs a careful answer. Pregnancy places significant temporary stress on many body systems, and researchers are studying whether pregnancy is associated with changes in biological markers of aging. But saying that having a baby makes women age faster is far too simplistic. A woman's long-term health is influenced by many factors: genetics, nutrition, sleep, exercise, stress, medical conditions, pregnancy complications, smoking, alcohol, socioeconomic factors, and access to healthcare. So pregnancy should not be presented as something that automatically makes a woman old. Instead of worrying about aging from pregnancy, focus on what we can control: healthy nutrition, regular physical activity, good blood pressure and blood sugar control, adequate sleep where possible, and routine medical checkups. Yes, during pregnancy, your kidneys work harder because they are filtering more blood. Most healthy kidneys handle pregnancy very well. However, problems such as high blood pressure, preeclampsia, diabetes, or pre-existing kidney disease can place additional stress on the kidneys. Importantly, a history of preeclampsia is associated with increased future risk of chronic kidney disease. If you had preeclampsia, significant hypertension, diabetes, protein in your urine, or kidney problems during pregnancy, don't disappear from healthcare once the baby arrives. Continue checking your blood pressure and discuss whether you need kidney function tests and urine testing with your healthcare provider. The major risk factors for osteoporosis include aging, falling estrogen after menopause, family history, low body weight, inadequate calcium or vitamin D, certain medications, and some medical conditions. There is also a rare condition called pregnancy and lactation-associated osteoporosis, where significant bone loss and fractures occur around pregnancy or breastfeeding, but this is uncommon. If you have severe unexplained back pain, repeated fractures, a strong family history of osteoporosis, or other major risk factors. Discuss your bone health with your doctor. So, as we close today's episode, remember this. Pregnancy may end with delivery, but a mother's health journey does not. Changes such as joint and back pain, hair loss, hormonal shifts, thyroid problems, and changes involving the heart, bones, or kidneys should never simply be ignored. Many are temporary, but persistent or unusual symptoms deserve proper medical attention. Most importantly, postpartum care is not only about caring for the baby, it is also about caring for the mother. Continue your checkups, listen to your body, and seek medical advice when something doesn't feel right. Thank you for listening to the Dr. Paul Health and Wellness System podcast. If you found this episode helpful, please like, share, follow, and subscribe. Take care of yourself, stay informed, and I'll see you in our next episode.